Hi, everybody. My name is Dr. Chad Rolfson, and I am the owner of the Spinal Tuning Chiropractic Center right here in Des Moines, Iowa. And a lot of people have been asking me about what this membership style is all about. And, well, I'll take a couple minutes, if you don't mind, to tell you a little bit about what it's like practicing within a membership style versus when I used to practice by doing insurance and all that type of thing. And I've been in practice nearly 20 years, and I've also spent my whole life in chiropractic. So I've run the full gamut. I've seen it all, folks. And this style of membership is something that, well, I tell you what, I'll never go back, to tell you the truth. I love this style of practice. It offers the practice member a more access to complete care. And what do I mean by that? Well, over 20 years, I've noticed patterns within the different patients that come through this door. Okay, and some of them are chronic patterns, and some of them are not so chronic patterns. Like, for instance, children, they don't really have a chronic pattern going on. Or if they do have a chronic pattern, it's usually short-lived. Adults, however, with patterns have had many years to kind of screw themselves up to set in the pattern and cement it compared to a child who hasn't had as many years to cement those patterns in. So that's just what I've noticed practicing over the last 20-some years about this style of chiropractic. Symptoms are not patterns, but patterns can lead up to symptoms. I want you to understand that. Symptoms are not patterns, but patterns can lead to symptoms. And what do I mean by patterns? Well, the different stresses within your body, the pattern of stress happening within your body. Okay? And if your brain can't communicate with your body correctly, what ends up happening is you have a lack of adaptation. Okay? Because that's what it's all about. Your brain and body communicate clearly, so you can allow adaptation and the body can respond to its environment correctly. Okay? If you think of it this way, have you ever had a boss that didn't know how to communicate? Well, most people go, oh yeah. Well, how does the company run? Okay? It doesn't run too well because there's a communication lapse. So I want you to think of your brain as the boss, the body as the company, with 1 trillion employees, or give or take a couple hundred million. Okay? If your brain and body can't communicate clearly, then what ends up happening is you get miscommunication and you get the body doing what it wants to do or what it shouldn't do without the guidance of the nervous system. And the nervous system is the key system here. And your body is a self-healing, self-regulating organism with the neurological influence. So interference can happen within that system. Okay? And that's what I do, is I remove that interference, allowing the brain and body to communicate together. What I've noticed, now getting back to the membership style of practice, compared to the pay-per-visit, okay? Now, pay-per-visit, I mean the insurance role model and all that type of stuff, because a lot of times with insurance, it is co-pays or deductibles, pay-per-visit. What the membership style of practice, meaning unlimited care for a flat fee per month, allows me to do is to establish new patterns that before I was unable to do under the limiting constraints of somebody's insurance company. Okay? Now, with the insurance company, it would get rid of the pain and the symptom, and okay, that's fine and good. But if you don't get rid of the pattern that's been established, well, in 2, 3, 6 months later, the original problem comes back. Or maybe a year or two later, the original problem comes back. So you're always chasing the same symptoms and the same problem, unless they fall down the stairs and have a new problem added on top. With the membership style practice, we can really go after patterns, not symptoms, but, well, I guess for symptoms too. We can go after symptoms really aggressively, but we can also start changing patterns a lot better than we were able to without charging the practice member an arm or a leg or their left big toe or whatever. Okay? So that's really the big thing that I've noticed over the 20 years that I've been practicing. Since I've been doing this membership style for the past 4 or 5 years, which is the first in the Des Moines area, it's basically taken a lot of interference between how I'm able to take care of the practice members that come through my door. Okay? And if you'll notice the analogy here, as a chiropractor, my job is to remove the interference out of the nervous system, allowing the body and brain to work and coordinate together more effectively and efficiently. As a chiropractor, another chiropractor asked me the question, how come we aren't doing that in our practices? This membership style of practice, unlimited care for a low flat fee per month, has solved that problem for me. Okay? So I just wanted to get this out because there's a lot of people that are confused about what a membership practice is. Okay? And there's really, people are overthinking it because a membership practice gets back to the simplicity of practicing chiropractic and developing the relationship between the doctor and the practice member more effectively and removing the patterns of stress in their lives more effectively. If you don't believe me, that's fine. Okay? I'm just telling you this is my experience over a 20-year span of working people on this level. And it's been a pretty great experience. All right, over and out. You've heard enough of me rambling. Have a great day. Take care.